The battlefield of the Renaissance was a place of horror and innovation. As gunpowder weapons replaced swords and spears, medicine struggled to keep up. The new wounds, deep, ragged, and burned with powder, were unlike anything surgeons had seen before. Believing these injuries were poisoned, doctors turned to a brutal solution. They poured boiling oil into bullet holes to purify them. For nearly a century, soldiers endured the agony of this practice, till one young French surgeon discovered by accident that gentleness could heal where cruelty could not. The story begins in the early 16th century, a time when surgery was less science than survival. Gunpowder had transformed warfare, and with it, the nature of wounds. Bullets tore through flesh, leaving blackened tissue that doctors assumed was contaminated with poisonous powder. Without knowledge of infection or bacteria, they reasoned that burning the wound clean was the only way to prevent death. Their weapon of choice, boiling oil often mixed with herbs, turpentine, or even molten metal. Surgeons of the day were not university-trained physicians, but barber surgeons. Men who cut hair, drew blood, and on battlefields, amputated limbs. Among them was Ambroise Paré, a young Frenchman serving as a military surgeon during the 1536 campaign of the Duke of Savoy. At that time, Paré followed the same gruesome procedures as his peers. When a soldier was shot, he would heat oil until it bubbled, then pour it directly into the wound to sear away supposed poison. The pain was unimaginable. Men often fainted or begged for death. One night, after a long day on the battlefield, Paré faced a crisis. He ran out of oil. Exhausted and desperate, he mixed a soothing ointment instead, made from egg yolk, rose oil, and turpentine, and applied it to the remaining wounded soldiers. He expected them to die overnight, since they hadn't received the proper treatment. But at dawn, Paré witnessed something astonishing. The men treated with boiling oil were feverish, swollen, and dying in agony. The ones treated with his gentle balm were calm and resting. Their wounds looked cleaner, less inflamed, and free from the terrible burns caused by oil. In that moment, Paré realized that his profession had been inflicting needless torture. "I resolved never again to burn so cruelly poor men wounded with gunshot," he later wrote in his journals. This accidental discovery marked a turning point in the history of surgery. Paré's observation that less invasive treatment led to better outcomes challenged centuries of medical dogma. His methods replaced cauterization with cleaning, dressing, and patience. Over time, his approach evolved into the foundation of modern wound care. But Paré's innovations did not stop there. He revolutionized battlefield medicine by refining techniques for amputation and blood vessel ligation, placing the standard method of sealing arteries with red-hot irons. Motto: I dressed him. When God healed him, captured his belief in compassion and humility over cruelty and arrogance. Still, change came slowly. Many surgeons resisted his methods, dismissing them as unmanly or unscientific. They believed pain was proof of healing. Yet Paré's results spoke louder than their traditions. His soldiers survived more often, recovered faster, and returned to fight another day. By the late 1500s, his gentler techniques had spread across Europe, reshaping the practice of military medicine. Looking back, the boiling oil method seems barbaric, but it was born from ignorance, not malice. Before the discovery of germs, infection was a mystery, and the line between treatment and torture was thin. Paré's breakthrough came not from theory, but from compassion, the willingness to question cruelty when confronted with evidence of mercy's success. Ambroise Paré would go on to become one of the most respected surgeons in France, serving for kings and publishing groundbreaking surgical manuals. Yet he never forgot that his greatest discovery came from an accident hand, from refusing to repeat a mistake simply because tradition demanded it. In the story of medicine, few moments are as symbolic as that night in 1536, when the fire of pain gave way to the balm of care, and the healing art began to turn, at last, toward humanity.